So my name is Brenda Gilmore. I started my advanced practice journey as a certified nurse midwife, and then I became a family nurse practitioner. And then in Florida, I got my doctorate in women's sexual health, and then I became a certified menopause clinician as a part of my doctorate. I have been working in traditional medicine for a few years, couple, and recently I'm starting my transition into functional health. I've learned a lot. I still have a lot to learn, but the premise of taking care of women and empowering them to take care of themselves is the same no matter what the setting.
This is true. What would you say is like the biggest shift for you from going from your old setting to your new setting?
Well, actually, the shift has been very exciting because, number one, I get to spend a lot more time with women's. I actually just said this to a patient. I actually get to make sure that every concern they have is addressed before the end of the visit, and I've never had that privilege before. And then the second thing is there's so many more opportunities for exploration of different testing that's not available in traditional medicine to help women understand their bodies better. And then thirdly, because we have so many more tools, non-pharmacologic tools, but still also the pharmacologic tools and hormonal tools that I may not always have in traditional medicine.
Mm-hmm. That's how I found functional medicine. This is because I was curious. My body was shifting. My body was changing. And nobody knew how to direct me, how to support me, how to even find me any relief.
Mm-hmm.
So I had to do, and this was like, how long ago now? Almost 6 years ago. I was scouring the internet, Googling, asking any woman who would listen to me, mostly people older than me, thinking they would have walked the walk already. But I found that nobody wanted to talk about it with me. Everyone kept their care kind of like secret, or nothing's wrong with me. Like, what are you talking about?
It's just natural.
It's just the natural part of aging. And then anyone who knows me knows there's no topic off limits with me. So you either. So I would be asking anyone I knew that would listen, hey, like, have you experienced this before? Have you experienced this before? And I didn't have a friend. I didn't have a woman in my life who was able to guide me in the slightest bit. Not even my OB, who I love with my whole heart because she delivered my baby. We had a really beautiful connection. And it was just, your body's changing. I can order you a scan if you'd like. I could offer you this prescription if you'd like. And I've never ever opted into a prescription opportunity. I've always been like really dialed in and felt really connected to my body to be like, I'm not really sure. So I kept digging and digging, which it wasn't until I had a fitness trainer who I was going to, who was like, you should go see my naturopath, which brought me into the functional space, which then hearing like the word perimenopause for the first time at 37 after Google doctor questions, passing me off to the next doctor. Now I'm finally finding a team that was like, oh, it sounds like some perimenopause symptoms. And that's when I heard it for the first time ever in that sentence. And I was like, what's perimenopause? At like 37, alone on a tele visit in my kitchen. So like, what would you say, like, what is perimenopause?
You know, this is such a great topic because, we fought for so long as for women to even acknowledge menopause as a thing, and that there are options to make our lives better. And sometimes I really felt, up until recently, perimenopause was kind of totally skipped. And perimenopause is, I kind of explain it as, if you remember puberty, how our bodies changed and how many of us were kind of crazy during that time because there was just so much happening, we didn't know what to do with ourselves. Perimenopause is kind of the same way, is your body's not, as women come to me and say, but I don't understand, my body's not the way it's always been. I feel crazy. I feel like things are changing and I have no control. And it's true, right? That's the way,
Correct.
probably the way you felt, is that our bodies and our reproductive bodies, our maturing bodies, I hate the word aging, our maturing bodies are making these changes inside that are natural, but they're not natural for us. And they really make us feel like we're out of control, just like when we were in puberty, except we're going the other way. Instead of our ovaries gearing up to produce babies, they're kind of gearing down. That part of our body is not coming to a close, but it's slowing down. And when that happens and our hormonal axis changes, it can really have an impact on every aspect of our body. So perimenopause is going from the way we've always felt as an adult to now like a bridge to menopause, but that bridge can have lots of bumps and lots of changes in weather and really be difficult to navigate.
Totally. And I remember when I was on my journey to find answers by myself, everybody said nobody said I was crazy because, again, like, knowing who they were dealing with, this was a very common thing for me to be like very curious. But I would hear things like from people being like, that's normal. That's so normal. And I was like, you mean to tell me you didn't sit alone in your kitchen crying for no reason? Or like your body, you would wake up one day and your body would just like feel different or like look different. And then everyone was like, oh, that's normal. That's normal. That's normal. And I remember when I went to just my annual because I couldn't get an appointment for questions, per se. So I was just like, I'll wait for my annual exam to unleash on my sweet doctor. And of course, there was not enough time.
Mm-mm.
And she was just kind of there for like the basic assessment. And we did the best we could, while she's examining me and we're chatting and I'm asking like deep questions. I'm like, this can't, I wasn't about to take like no for an answer. So I was asking for resources and support. And then again, she was like, let's book a follow-up and let's run these tests and these tests. But so quick to want to like give me a prescription with running 0 tests on me, which I was like, that didn't make any sense to me. But I will say, no one could really guide me. They were just said, that's so normal. Yep, that's so normal. And I was like, I don't like normal, and I wasn't going to take it.
And what does normal mean?
What does it mean?
I still am trying to figure that out. But I think from my experience, first of all, you're right. In a traditional, the idea of saving all your questions to your annual in a traditional setting is, it's impossible. And usually what patients do, because, I've worked in this traditional setting, is they wait, it's called hand on the knob. So they wait, right? They want you to get all your stuff done. Then as you're leaving, they say all these deep questions, they want answers. But the traditional person, their time is up. They don't have time. So that's not uncommon. Here, I've had some women come to me and say, I don't understand what's happening to me. I can't lose weight. I'm moody all the time. My periods are crazy. What do I do not feel like myself. And it would be very easy to say, it's normal for you. It's normal. But even if it's normal, it's still so important to take a step back and figure out how we can support you in this transition. There are so many things we can do in functional medicine, especially with our health coach and the nutritional and lifestyle changes. A lot of people don't realize that the things you used to do when you're younger don't work in perimenopause, and you need help and support. And that's kind of, we have time to do that.
We do have time.
And we have the resources to do those things. And we know how to do those things. I'm very excited to be able to walk with women in this very unusual, not normal, transitional time of their lives.
Yeah, and I'm trying to think how to phrase it, but like, how long would you say that we should or normally like normalize these symptoms before realizing hormones could be at play?
I don't think we should.
0 minutes.
0 minutes.
0 minutes.
I love that. 0 minutes.
Yeah.
I have women who are 35, which is pretty much 15 years before the average normal menopause transition, but it's very apparent that their ovaries are also already talking to them, right? They're
Correct.
already saying, girl, I'm just not going to work the way I used to work, and this is how things are going to go. And the woman is like, wait a minute, I'm not ready for this, and they need to be heard. And I think that's the one thing that we do here, because I think one of the things you were talking about, your sweet, dear OB person, is you didn't feel heard. And I have women cry here because for once someone has stopped and said, you are not, because they feel crazy. You may not say you are, but you feel crazy. And they say to me, no matter what else we do today, the fact that you took the time to listen to me and help me navigate this, that's what we do here. And then we can do additional testing. We can do non-traditional testing, hormonal testing, other testing, to see where you are. And we can meet you where you are. We can listen to you and your intuition, because that's the other thing I've learned here, is if you actually listen to women, they know what's happening and they know what they need.
Yeah.
But we haven't been listened to for so long, we don't even believe what our own intuition's telling us.
Absolutely. And I think that sometimes not many people witness this, but I often am their first voice that they hear when they're calling the clinic. And
or when they walk through the door.
Or they walk through the door. And I will hear their story for the first time, or they're sharing their story for the first time. And there's been times here where like I'm in tears, the patient's in tears, and I just have to like sit with it because I've been them. I'm like, I've been in your shoes before, and I don't even like sell a service here. I don't
have to
sell anything. I just give them hope that answers are here, and there's a team here that can support you. No if, ands, or buts, whatever we uncover. Because more oftentimes than not, it's more than one thing.
Of course. Right?
I'm like, welcome, and you're gonna be here for a while. Buckle up. But it's exciting, and it doesn't always have to be like a bummer. It can be an exciting time and a beautiful time, and just to learn about your body and get excited about what's next.
Well, and that's a good point, because it's very exciting for me when I do free consultations on the phone and people don't actually have a problem. They just want to live their best lives and be their healthiest. And I get so excited when women are so empowered that they can take that step before there's something wrong, so that we can literally walk beside them throughout this journey. And when you said, if you're perimenopausal or you want to come see us during that time, we can walk with you right up to when you go through menopause. We'd be happy to do that. Or we can walk for you for a while and you can go and live your great life and then come back when you need us to walk again. That's what we're here for.
Totally.
And the fact that we can support women where they're at, where they want to go, and we have lots of different ways to help them get there.
Absolutely. I think one of the biggest things too that I'm an oversharer at the desk. I can't help myself. I'm excited to hear like their interpretation of the visit, and I'm always like, how did it go? And they are so thrilled to have answers to kind of connect all the dots and kind of start to put the pieces into place. And then I'm excited to ask them like, what is your, vitamin D is probably my favorite micronutrient ever, and then I'm able to just share my story and share how the clinic has supported me in more ways than one to find relief more, let's just say immediately. Like you don't have to, and I hate to use the word suffering, but like you don't have to suffer. You don't have to be uncomfortable. There are tools that we have here in the clinic to get you feeling better, like if not next day. And through the injections that we have here with vitamin D and B12, like
And our IV therapy.
I'm
Yeah.
like, you will leave here feeling like a euphoric superhuman if you just like, get your tests done, get your labs done. Let's figure out what's going on. And then, because again, I didn't have this when I started. I did start HRT, when I was 37. Low dose. But like, what would you say to women who are curious about starting HRT?
I think that actually one of the things I've learned, traditional medicine for a long time was like, if you're still having periods, no HRT for you because it's going to mess them all up. But I think the research out there and the awareness now is it's a decision between the woman and the provider. And the fact here at Holistic Health Code, we have so many tools to help us to figure out exactly where you're at. And it may not be the traditional hormone replacement that you would think about, especially in the perimenopausal period. Because what many people don't realize is during perimenopause, when your ovaries are kind of still trying to climb up that hill that they have always traveled, you can actually have really high estrogen levels, unlike menopause when you have really low estrogen levels. So because of that, hormone therapy is warranted, but it may be very different than you would think of during menopause. And I think that's one of the exciting things for me, is to be able to offer that detailed and very individualized approach. So and honestly, if you taken a birth control pill, you've been on hormone therapy. It's the same thing.
Yeah.
It's just that the hormones are a little bit lower and different during perimenopause and menopause. But I think we can give a very individualized approach to make sure that it's not just, you're perimenopause, we'll go put you on a birth control pill, it will regulate your periods, you'll be fine. That may not be what everyone needs. And here we can do a very individualized approach, so we can do exactly what works for you. Along with, like you said, it's never just one thing.
Never.
So it's along with all the nutritional support and the lifestyle changes. And we have many different other root cause analysis type things that we can help support other things that may be going along with the hormonal changes that aren't available in traditional medicine.
Totally, because what we talk about, you and I, all the time is stress hormones. Mm-hmm. And we talk about how, our whole life, all of our life experiences are still living in our bodies, in our tissues on a cellular level. The body keeps score. The body keeps scores.
Whatever you did when you were a little one, it's still there.
It's still there. So women who are because again, like in this space too, in this functional space, there's a lot of buzzwords circulating. There's a lot of influencers out there sharing these buzzwords around HRT or get your blood work done. And we are root cause here through and through. And we look at the whole human, the whole body, and the whole circumstance of their life.
And can we talk a little bit about in person
Yeah.
versus virtual?
Sure.
Because I'm able, and I'm very blessed to do in person here. We do a lot of virtual, and I do think there's a place. But I was actually talking to my husband about this, that I don't think I'll ever work in a place where I can't meet the women as much as possible. I mean, we see people out of state or whatever, but I love the fact that we have the option for them to come here in this beautiful space and really see what they're dealing with and really focus on them as a person. And virtual is something we offer, and I'm happy to do that. But for people who are really going through things with perimenopause and menopause, it's great to really do face-to-face and say, do an exam, see how things are going, and really talk to them. So I'm very blessed that I can offer that here as well.
Yeah, we're so lucky to have you. But you're so right, because, to your point, the people who do come into clinic, they don't want to leave. And they don't want to leave. And they will sit with me or want to stay longer because this feels like such a safe space for them on so many different levels. So whether they're, working with nursing within the IB space or have a provider-led visit, or, they'll sit with me after because they really do need to then digest it all. And I'm like, you can stay as long as you like. Obviously, I would love to talk about your appointment and then just continue to share most all of your patients. You may not know this because you go back in and see maybe the next, but will stay and just need a moment to debrief, download, breathe, cry, and be like, what just happened?
Right.
And I'm like, yeah. And I often refer coming here to like Disneyland. On a couple different ways, but I'm like, it's literally like the greatest place on earth to kind of get the care that you need.
Well, and you can get your women's health stuff done here too. You
Absolutely.
can do your PAP and stuff here. I'm happy to do that. If you have, recurring problems like the microbiome and things like that, then I'm more than happy to work with people. I mean, I've been a midwife since 1996. I know the vagina pretty well.
We know the vagina.
Yeah.
We love the vagina. Well, that's a great segue into like the vaginal health and just the vaginal microbiome and things that are often not discussed ever.
Well, women put up with a lot because they're either too busy or they don't, it's just subtle things that they know aren't right with their body, but they don't want to say anything. It's a very personal, protected space. And that is one very exciting thing here that I can offer, or we can offer, any one of us can offer, is we can actually do a microbiome test of the vagina. We do the microbiome of the intestines or the gut all the time, but the gut and the vagina are not that far apart, and they really influence each other. And if there's a dysbiosis in the vagina or a mismatch in the vagina, it can have it can have a huge impact on a woman's health.
Yeah, how would you say they're like connected?
Well, because if you think of anatomy, the vagina and the gut, the exit of the gut, are really close together, right? So they talk to each other. And a lot of times if you have a dysbiosis in the gut, it may have an impact on the vagina. A very good example is yeast, right? If you have a lot of yeast in your gut, you're going to be prone to having issues with that in your vagina. So they talk back and forth. It's like the microbiome on the skin. It talks to everything too. So being able to test that to make sure that it's balanced and in a place where women feel good. And if not, there are certainly interventions that we have, and not all of them are medication. Many are pharmaceuticals.
Right.
A lot of them are supplements and things like that we can help, as well as, and is a big factor, is lifestyle changes. Our society tends to be almost over cleaned, so things are washed very intensely. And in that area, if you do that, you could actually be causing more problems than good, because it is a balance of bacteria, yeast, lactobacillus. All these things work very well to keep things balanced. But if you're washing all that away,
Yeah.
then you're allowing what we call opportunist bacteria to overgrow, and that can cause a lot of problems.
Yeah. Yeah, I would say that too when a lot of my friends who have like chronic yeast infections, or we're hearing a lot about BV, again, like they're hearing these taglines and then being like, I have that, and self-diagnosing. More oftentimes than not, no one's looking at the gut to then be able to treat what's going on in the.
No,
And
you really have to look at both.
You have to look at both. And again, like test, test, test. We always say here, test, don't guess. Like, let's figure out the root cause so that we can actually give you like the answers to your body, because we're all different.
Well, and to that point, when I interview people and they're having problems with the vaginal concerns, a lot of times they have GI issues too, and they never put the two together.
Yeah.
So, and we need to start doing that.
Yeah. Well, now I know here, to me, it's second nature to like always, but then when I'm out in the wild where people like assume I'm a doctor and I'm like, I'm not a doctor. This is not medical advice. But I've done the work and I've researched this for so many years, and I ask a lot of questions, and I'm in this space and I have a front row seat to the work that this team has been doing, and I am a forever learner, and so I'm always like absorbing. Hence why every time when you walk in the door or you walk out the door, I'm asking you one more question, only because I'm like so excited to learn alongside of you. But it had probably come up that day. Usually what's happened, I'm like, let me ask Dr. Brenda as she's like exiting or entrancing the clinic, where I'll be like, what are your thoughts on this? Like, we had a conversation around, what was it the other day, when I was like, why was I asking about cervical mucus?
Oh, because fertility.
Oh, right. We were talking about that, and you explained cervical mucus to me in a way that I've never heard it before, ever explained. At 43, I'm like, shouldn't I have known the benefit of cervical mucus? Like, why doesn't it come up in conversation?
Oh, because we were talking about ovulation.
Yes, that's what it was.
And then,
Yeah.
you can actually tell whether you're ovulating or not. Many women who are very in tune with their body know when they're ovulating, because they track their cervical mucus, because the hormones change the way it acts and looks.
Yeah.
So, yeah, and that's the thing, is I think women know a lot more about themselves than we give them credit for. And that's one thing we do here, is we do try to give them credit for that.
Absolutely.
So even if a woman is 50 and she's still having a few periods, and she's having hot flashes, night sweats, vaginal dryness, all the things we have for menopause, I don't say, oh, well, you're still having periods. You really can't worry about that yet. Because the transition from perimenopause to menopause can be very subtle, right?
I'm not there yet.
That's a good thing. And so I think that's, again, like you said, and I think you kind of walk us along with them too, more from a lay person than a provider. And that's necessary too.
Totally.
So, and I think that those are all great things about this environment.
Well, yeah, and I think that's why, like, I like to think I'm a part of their care team.
You are. There's no.
Oh yeah, there's no
think. There's no think
doubt.
about it.
But again, I think they'll share things with me that they may have forgotten to share with you, or didn't feel it was the space to share with you. I'm like, the more you tell your provider, the more they can help you. But then I'll share my story always as a framework or a reference point for them, where I wasn't always like the most in shape human being, but I was like always like, you know, took care of my body. I always moved my body. I was always like mindful of the food that I was eating. Mostly because like I'm not a foodie. So I was just like, I like my food on the blander side. But food was always something where I didn't really use as medicine before, or thought of it as medicine, and how it affected like every component of my body. Because another thing that I always share with people, when I first started getting my labs done and read by a functional medicine team, one of the next things that they told me was that I was malnourished. And I was like, a little thicker at the time. I had a little more love all over my body. And I was like, how am I malnourished? Look at me. And then she was like, the size of you has nothing to do with the nutrients.
Actually, some of the people that are most nutrient deprived are in the obese category.
Yeah.
But that's a very good point, and I think it's very important, especially in menopause and perimenopause, because as we get more mature, remember I don't like aging, more mature, our metabolic rate naturally changes. So the things that we could get away with, those non-nutrient foods that we could get away with when we were younger, have a much more heavier impact on us. And it's a very subtle thing. People don't realize that they're making choices that may not be the best for them at their stage in life. And I think we can really show them with their labs, like you did, like you found that these things, you know, functional, the way we look in traditional medicine at nutrition labs and the way we look at from a functional medicine lens is so very different, because lower end of normal is okay and traditional, but functional it's not, because we know that the body needs to be much higher, like in the 80% of the range of like the vitamins and all those things to actually, you can function, but you can't have your peak of wellness unless you're really well nourished. And that's why I think the health coach and lifestyle option that we have now, that we're so blessed with having Rebecca now,
Oh yeah, she's great.
that she can help bridge that gap. We can say to them, you need more vitamin A and vitamin D and vitamin C. And she can say, this is how you can do it. I mean, we can do it a little bit, but she's the expert, right? So, and I think that's a whole piece. Hydration is big. Nutrition is huge. All those, and movement. And something that Dr. Meg talks a lot about is mind and spiritual growth.
Yep, gotta get your mind right.
Yeah. Because that we don't realize. That's why when you talk about being positive and being grateful and being in a better space mind-wise, which we can help with, then balances a lot of the other things, the other changes that are occurring.
I know it's going to go back to stress hormones again for me, because again, I see it so frequently, and then it's a delicate conversation with our patients who I'm not here to tell you you're stressed. Like, we can look at your labs and say your or I don't ever look at anyone's labs, but your cortisol appears to be what it is, or your adrenals might be something
completely depleted.
And then they're out there, and as women, naturally, we're like superheroes, right? So we're like trying to keep the ship moving in their lives and doing, you know, we're working, or we're moms, or we're working out, and we have to have a social life, or this, that, and the other thing, and then they're gaining weight, and they don't know why they're gaining weight, but they're not eating because they don't have time to eat, and it's
They're
just
not sleeping.
they're not sleeping.
Sleeping
We're
is
like,
huge.
it's just so crazy to me where when a woman's like, I'm here because, you know, my body's changing and I'm gaining some weight, we're like, I'm looking at mental stress hormones, lifestyle, like, who do you hang out with? Like, sometimes I'm like, what does your life look like?
Mm-hmm.
What do you absorb outside of?
Yeah. How much mold is in your house?
How much mold is in your house? What do you cook with? What are you putting on your body?
Mm-hmm.
And again, it's like slowing down and like we're almost unlearning. We have to unlearn.
I've definitely had to do that. Coming from a traditional background, I've had to unlearn and kind of rebuild back up. And even, like I said, looking at labs, I look at completely different than the way I did. I did a traditional setting, and it's for women, it really is about they don't even recognize the stress that they're under because they just do what they have to do. That's what we women do. We do all the housework. We work full time. We take care of 3 kids. And what people don't realize is the cascade of reproductive hormones comes from the same cascade as your stress hormones do. So if you're depleting your stress hormones, you're also probably low in everything else. So, and we can test for that, right? And we can help support you to do it. But it's not all about supplements it's a combination of everything. Looking at the whole picture, looking for that root cause, and then walking with a woman as they go through these things.
Oh, yeah. And what we say often to, more so me on the bookends of the visits is, 90% of your success or your transformation will happen outside of a visit.
Because you'll look at things differently.
You'll look at things differently. Your provider is going to give you like your answers that you're looking for. And now we let them walk out the door.
But we've given them tools to, do what they need to do to make themselves, because we can only do so much. We can tell people what we can do this for you and this for you, but they're the ones that have to grab onto all of that, bring it forward and do it.
Yes.
And
yep.
You're right. Most of the work happens outside.
Most of the work happens outside.
When they come here or when we do a virtual visit, that's a safe space.
Yep. Safe space to share kind of anything that kind of comes up for you. But is there no way to get it out? They're doing some construction. Isn't that funny that they have not been building for 6 months? How are we doing on time?
We got like 10 minutes.
Okay, cool. Do you want to talk about when you were just recently, you said you listened to a podcast that you were super inspired by.
I did. It was on, it's called MCAS, and it's, I'm got a blank on it now. I just completely
No worries.
get
That's
no words.
perimenopause for you. That is right there. Brain gone.
It's
Like,
just
why did I
like,
walk into this room? Isn't that wild?
Yeah, it
So
did.
crazy.
So we'll talk about
that another day. Yeah.
But what we really haven't talked about, maybe we should use the last 10 minutes on, is actual menopause.
Let's talk about it.
So, it's funny. It just completely went out of my head. I can think of the acronym, but I can't.
No worries.
So anyway, menopause.
Menopause.
So I think that, there's a lot of buzz about menopause now. Women have really kind of risen up and come to mast cell activator syndrome.
Amazing. I didn't know that's where you were going. It would have helped you out. I thought it was something else.
So, but we'll put that on the table for next time. but menopause, because that's really what we're here for. It's interesting how what history has done. Probably about 25 years ago, there was a big women's health study, the Women's Health Initiative study, that was done, and they used hormones that we actually don't even use much anymore. And they used them on women who were much older, like in their late 60s, early 70s. They started, and we still use hormones in the age group, but usually they've been started much earlier, like in 50s, early 60s. So they were sure that hormone replacement therapy was going to protect women from heart disease. But because of the hormones they used, and probably more prominently the age group they started the hormones in, it did not bear out. And actually, in some age groups, it increased the risk of heart disease. So back in the early 2000s, we couldn't sell hormone therapy because this study, which has been kind of refuted and revisited and has shown that, a lot of the design of the study was not optimal. But it scared a lot of women. And the media really scared a lot of women. And so it just is so interesting because now more studies have been done on the right population with the right amount of hormones. And FDA just took out the black box warning, say that hormone therapy is very safe. So we're all like, yay, right, as providers, if they're prescribed in a safe manner, right, with certain things. You don't have a huge cardiovascular history. You're in the middle of menopause, not at the end, like in the 60s. There's a lot of different things we look at with hormone therapy. But it's an exciting time because women now are empowered to say, okay, I don't have to suffer. And in menopause, hot flashes, night sweats, vaginal dryness, that word is very descriptive of how some women feel. And many of us who kind of went through menopause closer to that Women's Health Initiative study, we didn't do hormones because we were so afraid. And now, as kind of the pendulum has swung, we have better products, better bioidentical products, more like our natural hormones. So women have they get their lives back.
Yeah.
Right? They really do. And so that's an exciting thing to be a part of for me. And with the functional health testing that I have access to here that I don't have access to in traditional medicine really helps hone in and personalize treatment, which is very exciting for me. And so I think that now that we not only do that, but we help support women in that perimenopausal period. So basically the whole transition can go so much smoother than many people who just kind of felt like they were, crawling into a hole then crawling back out again.
Yeah. Well, what I also think is cool about like our caseload and our patients, and they're paying attention, and then we have like documentation of their journey. Whereas I feel like before I found functional medicine, I like was at the doctor once a year. Once a year, just kind of like, you good? And they weren't really running any lab work on me, minimal if I asked them to, but I was an advocate for myself. So now someone who's been, in the peri space, how long can you expect me to be in this space until, what should I be looking out for, like, when menopause is creeping in? What will change for me?
I think that sometimes it's more subtle. A lot of women, the first thing that happens, because menopause symptoms, remember I said sometimes in perimenopause your estrogen levels are actually a little bit high, and then when you go through menopause they kind of go down. But there's this also, the ovaries are still trying to work, so it's the symptoms of menopause are more from fluctuations.
Oh, God.
So it's very subtle. Well, some women it's not. It can be pretty drastic, but some women it's very subtle. One of the first things that usually occurs is night sweats. I think because of the changes in hormones nocturnally, women will say, I wake up, wanting to throw my covers off, I'm sweating, and then the next minute I'm freezing, so I got to put it back on. That's usually the first thing. And then subsequently, people start getting those same hot flashes, the rush of heat makes them sweat. A lot of times it's in the face and in the chest, and they can be very frequent during the day, and it can affect their lives. Like they're trying to run a business meeting and they're sweating.
Yeah.
I have a great story of a friend of mine who was a real estate agent, and she was actually selling my house at the time. And so we were doing a walkthrough with the new owners. And so I was showing them, how we took care of the house and everything. And I turned around and my friend was nowhere to be found. I'm like, where did she go? And I just walked back into the house. The house is completely empty. And she's in a back room peeling off her clothes like, and
Love her.
And I'm like, that was not typical, but a very good example of what can happen. So she had to leave her job, basically.
Yeah.
Well, I was her friend, so I understood. And what I do for a living, I definitely understood. But she literally had to leave the scene to take care of herself because it's just so overwhelming for women. They can't sleep. They feel very irritable, and they really, mood changes and those type things can happen. And then the other thing that people don't talk about, with the lowering of estrogen, the vaginal changes. Things aren't as moist as they used to be. Things hurt that didn't used to hurt with certain activity. And it's really, a lot of women say, I think I have a desert down there. Vaginal dryness is a really big thing that many people don't want to talk about, but that's another big piece. So this is all what you get to look forward to.
I'm thrilled. So excited, but I feel better only because, again, I'm always going to champion this conversation, and every time I chat with friends, they're like, oh, that's not me. Like, I'm like, you just don't know. I'm just super dialed in and super aware, and I knew my body was changing and I wasn't going to let it. And I was like, nope, I'm doing all the things. I want to optimize. I want to feel, because a lot of people know me too as like this really high energy human being. And I don't really drink a lot of coffee. Like I'll have like a cup, maybe.
I don't think you need it.
I don't need it. And so when I was like, my body was like saying halt, I was like, I was a version of myself that I didn't even recognize. And it was not normal for me to like isolate or be sad all the time. And that's when I knew like something is wrong. And I just like knew I had to get to the bottom of it. And it wasn't, it was like small tweaks that made me feel better, like a vitamin D shot and low dose of progesterone. And honestly, that's where I started. And it was just like, oh my God, the sky is bluer. Right. And I'm myself again.
And sometimes it is definitely subtle changes. But the other piece to that is this transition is so individual. Some people have no hot flashes whatsoever and say, I don't know what you're talking about, I'm fine. And other people are like crawling on the ground, and then everything in between. And I think it's really about tuning in like you did for your body and working with someone who will help you figure out what you need.
Totally. Yeah. Don't stop until like you feel complete with your answers, because like.
And the other thing is, and I think you found this too, is there are little gentle things we can do at the beginning, but it is a process. And that's why our membership is so great, because you don't have to wait a year.
No.
We follow you closely. We make sure you get what you need. You have access to our portal all the time. And we, really help support you through the whole
Yeah,
Right.
when you get one of us, you get all of us.
Yeah, whether you like it or not.
Whether you like it or not, someone's coming in, and we're just there to check in and to guide and just to remind you, like, you're human, and yes,
And we're here for you.
and we're here for you, and you're normal, and you're not crazy,
Right.
and it is but it's gonna
And
be
your
forever.
experience is your experience, and we'll work with you with that, and not expect you to be cookie cutter.
Correct.
So,
Oh my gosh. Well, thank you, Dr. Brenda. This was amazing. We'll see you later.
okay.
See you later.